We are live. We can proceed. Dr. Pratik, you can start.
Hello, good morning, and welcome to all the delegates that have joined us for this today's webinar. I am Dr. Pratik Bam, a second-year postgraduate student from the Department of Prosthodontics, Tirthankar Mahavir Dental College, Moradabad. I am hosting this session along with Dr. Anmol and CEO of Cynodent team. For our today's session, we have a speaker, Dr. Anisha Maria, with us. Firstly, Cynodent is a unique platform, first time in India, a digital healthcare platform that provides and enhances good relationship between the patients and the doctors, and it also enables a real-time appointment scheduling system. Our goal to create easy access to healthcare services and communication ways or appointment scheduling system, not only between the dentist and patients, but also for the medical practitioners, diagnostic labs, to the radiological services and pharmaceutical services. Also, we keep them updated regarding the same. Cynodent bring together at economic prices and minimum waiting time because everyone has 24 hours and we have to utilize it without wasting it. Cynodent is here to create precious healthy smiles on our patients' faces with minimum effort and maximum welfare. Cynodent is an initiative that will put up all its efforts to create the beautiful smile on patient face as always. Now, patients do not have to wait or fear those long queues and the busy dentist when they get an toothache. So with this, we come up to our today's webinar brought to you up by Cynodent. We have for the topic no knife cosmetic fixes for the face. This session will be the speaker for this today's session is Dr. Anisha Maria ma'am. Dr. Anisha Maria ma'am is an oral and maxillofacial surgeon. She is the professor and head of the department Oral and Maxillofacial Surgery at Bhabha Dental College and Research Center, Bhopal. She is the ex-dean of Rishiraj Dental College, Bhopal. She has published over 40 national and international papers in her specialty. She is a passionate academician and have been teaching UGs and PGs for over 25 years for now. She has been invited as keynote speaker in many state, national, and international conferences. She has the special interest in facial aesthetics and has an active private practice devoted to facial aesthetics. She is a consultant oral surgeon to 3 most renowned trauma hospitals in the city of Bhopal. On behalf of complete Cynodent team, we welcome you, ma'am, for our today's session. Dr. Anisha Maria, ma'am.
Thank you. Thank you so much. At the outset, I want to say thank you for the lovely introduction, and I want to thank Dr. Anmol Bagaria for having me over as a guest speaker today.
Pleasure, ma'am.
It's a great pleasure for me also to be on this platform. I just love to teach. So since I am, myself not very old into this field, facial aesthetics was not a very, you might say, procedures are not usually done by dentists. But in the last 6 to 7 years, slowly we have started to do it. And I feel it is something we can easily master. And I shall be, in my lecture sort of orienting it that way. How it will help our dental practices in a better way to even learn about facial aesthetic procedures. So I'll just share my screen. Where is this? Yeah. So good morning, everybody. And my topic for today is no knife cosmetic fixes for the face, which, as the title says, they are going to be non-invasive procedures, and anybody with a little care can master these procedures. I will show you the contrast between how we surgeons actually can do a little surgical tweaks to the face. But these are main focus of my talk is going to be to the no knife cosmetic fixes, right? So let's start. I think it didn't get one. Just a minute. Yeah.
Yes.
Now we all know that cosmetic industry is worth billions of dollars. I mean, across the counter, so many cosmetic products are sold, you know, right from creams, lipsticks and whatnot. Why is it worth so much? Because all of us want to look presentable. And as the years are passing by, this need to look good is increasing in all of us and in the youngsters especially. And this need to look good was not anything new. It is there from ancient times. Men and women have always wanted to look their best. And I have put in the pictures of our very ancient queens from Egypt. Cleopatra, everybody must have heard about her from our history lessons. And Nefertiti is the second picture here, which, as you can see, were known for their beauty. And I believe Cleopatra was supposed to have, you know, bathed in milk and honey to keep her skin looking gorgeous, I believe. And Nefertiti is known for her jawline. And even today, it's a sign of beauty that a woman should at least be showing her jawline in this angle over here. And we are having a lot of surgical as well as non-surgical procedures which, you know, try to aim to get this jawline in a person's face. So it's still called Nefertiti lift in our procedures. Now, the question that is asked by the dentists who are not knowing these procedures and are just hearing about it is that, can we dentists do these procedures? And I say yes, and I'll give you 4 good reasons why we can be very good at this. First, because it's time to own these procedures, because we dentists have spent maximum time studying anatomy and function of facial features. And first year BDS itself, we have done muscles of facial expression, if you remember, but we have sort of neglected it and moved more on to muscles of mastication as dentists rather than the facial expression muscles. Second point is that do not forget everything is going to be based on overall health, nutrition, and hygiene. There is no short-term fixes for getting to look good. Let me tell you, we are all doctors basically, and we have again been focused right from, you know, 10th biology to 12th biology to even first year BDS. We have been talking about our the vitamins, proteins, carbohydrates. We know all about it. We know what we get from which vegetable and which fruit. We all know that vitamin C, A, E, etc. are very essential for our health. And when we are talking about skin well-being, we come back to having a lot of interest in vitamin C again. So therefore, whenever we are going to be talking to our patients while working in this particular field, we are going to be also giving them a little counseling over what kind of nutrition they are having, whether they are following the correct hygiene for their skin or not. And we'll have to be talking about their inside well-being rather than just, you know, doing something on the face. That may be not working for them in the long run if they are going to be casual about the rest of the things and you are only going to be doing something on the face. So remember, we are going to be counseling them on our health, nutrition, and hygiene again. In case we have forgotten that, kindly revise it again from your physiology and biochemistry of first year. And we are also already dealing. The point 3 is that we are already dealing with teeth. We are doing smile designing, bleaching, laminates, etc. in order to make the patient look presentable. So you can see these pictures of the teeth before and after, and we feel we have made the person look so much better because her smile is so much, or his smile is so much more attractive. But why are we forgetting the rest of the face? So let's see, the fourth point is that we are the masters in local anesthesia. We have been taught thoroughly how to give local anesthetic injections. And I think no other specialty of medicine is into this except anesthetists. But even they don't give blocks on the face. They are giving spinal blocks and other types of blocks, and of course general anesthesia. But it's the dentists who are used to giving injections for anesthetizing areas of the face. While you're right, we have been focusing only on the oral cavity so far. I think it's not very difficult for us to give infiltrations on the or give extraoral intravital blocks or anything. They are very easy to master. Once you have been handling the syringe, it's like a basic armamentarium in dentistry. So that is the fourth reason why we are going to be able to do a better job in this, because we have a head start compared to an MBBS student or even an MS or even a plastic surgeon doesn't no local anesthesia of the face. He has to relearn the whole thing. And neither do dermatologists, neither do any other specialists of the medical side. Now, why are we forgetting in all our cosmetic procedures the soft tissue drape? We should look at the lips which are surrounding the teeth. That is the frame for the oral cavity. So when we are not bothering to see whether the lips are discolored or they are, of the right thickness, or are they framing those teeth that you have designed so beautifully? Are you showing a lot of gum? If there's a lot of gummy smile issues, just aligning the teeth is not going to make the patient look good. So you need to maybe even correct that fact that you don't want a gummy smile. And these are the things that are going to help us give the patient an overall better looking face, not just the teeth. So when you learn these skills, you start to broaden your horizon. All this while you are only doing smile designing, you are learning, laminates and all those things and making the person look good. And now when you learn the soft tissue issues also, I think you'll become a more wholesome dentist, and you'll be able to do even a super job on the whole face of the patient. Now, to make the person look good, we should be able to work on the full face. And one thing that helps us is that today's generation is under pressure to look presentable also. I mean, more and more people are taking interest because of social media and whatever, selfies and whatever. We all want to look good now. And also, because of medical science, we are living longer. So the person who's in the 60s and 70s is no longer like your old grandmother who would say we are retiring or anything. Now the 60s and 70s are the new 40s, let me tell you. So we are not going away anywhere so soon. So we want to look presentable even at that age. And I'll give you a lot of examples here. Of course, I've taken a lot of, you might say, public figures pictures. But these all people that you're seeing here are over 70 years of age. Of course, Sushma Swaraj has expired now. But these guys and girls that you're seeing here, Queen Elizabeth is 90 plus. So they are still looking not like our grandmothers did in our generation. My grandmother, forget your generation, my grandmothers were looking like ab to theek hai, let us just settle down, banna thanna kis liye abhi. They were in that mode. But now you think Hema Malini, I think she still looks better than her daughters, you know. So everybody is looking so good. Hillary Clinton, she's also almost 75. Vladimir Putin is the Russian president. He is well-known. I mean, well-known in the sense that nobody advertises that they are using help to look good, but it's a well-known hidden secret, you might say, or an open secret that he uses a lot of Botox to keep going. Now, when we look at a person, look at these two people samples I have put over here. When you're of the same age, you can see by yourself who you feel is looking fitter and better at that age, right? And we want to look uh, good till the end. That should be our aim, actually. We should be, and to look good, it's not just those cosmetic procedures which are making these people look good. Shilpa is known for yoga. She is seriously into yoga and her health. So these guys are not just, they go to gyms. They are working out. Hema still dances, and dancing is a very good form of exercise. So look at Anil Kapoor. I mean, you can't even see the age. We call him forever young. So these guys, why are they looking good at that age compared to the person next to them, is because they are working hard, not just on their features, but also on their overall health. And that is why as doctors, when we will be doing facial aesthetic procedures also, we will take case histories and we will give a lot of instructions regarding their health and well-being also, remember. So you're not just going to say, I'm going to do this on your face and you're going to look beautiful. It's not like that. You have to treat the patient completely. Then we have another misconception. I wanted you to appreciate these pictures we have taken, because we feel that when we are young, we look the best. Okay. Now, for example, Pratik will feel he is looking the best today at this age, and at 40 or 50, he's not going to look good. That feeling may be there. But look at these examples of Rekha in her youth. I think she looks so much better when she is in the current photos. Look at Shilpa, she looks so much better now. So what is it that, it's not the youthfulness, the best years of your skin and whatever it may be at that age, that is not what is going to make you look. It's overall over the years, maybe a little bit of character has been added to the face because of experience and whatever they may have gone through in life. And in addition to, of course, maintaining themselves in a proper way. And they have had a little help from aesthetic procedures, there no doubt, but still a person in her youth will not go for these aesthetic procedures also. Nobody in their 20s is going to go and say, do something for my face. But had they done it at that stage also, maybe they would have got this look at that stage only. So yes, it's not necessary that we look our best when we were young. We may be looking better when we reach our 40s and 50s, in fact. So let's move on to the next slide. So we have Rekha, who's a very epitome of beauty even today, and that is why she is worshipped, because she can still look great at 70 almost. This is 65, 67 now, maybe my old slide. She's not 65 years old. It depends on what you want to call her. 65 years young. And then you have men not far behind. Now you will think only women are going to run after aesthetics. You're very much mistaken. Even in my practice, I have 50% of the boys come in, or the men come in for the treatment. So yes, males also are very keen, and their major problem is hair loss. We have issues with the hair loss, so they are going into transplants and hair regeneration therapy, and that keeps them young. And let me tell you, nothing is permanent even in these procedures. Hair transplants have to be repeated over 5 or 6 years cycle. Salman, I believe, has undergone almost his third stage of hair transplant again. So these men also take care of their looks. Now, one thing we must, when we think about facial aesthetics, I want you to understand what we consider when we are working in this field. First of all, beauty is in the eye of the beholder, that's understood. I have here pictures of beautiful women from all parts of the world. She is British, she is Indian, Aishwarya, she is a Saudi Arabian, she's a Scandinavian, we have a Korean, we have a Chinese, we have a Nigerian. So, we have so many, but it's not the skin color or the color of the eyes or the shape of the eyes which is deciding the beauty, because that races have different types of eyes also, so it's not that which decides the beauty. So what is this beauty which is universal to the whole world? Because you won't say she is less beautiful than her. No, everybody is having a certain thing that is called golden proportion. Okay, every face that is given a presentable look, or which we all, whether you're a Nigerian or an Indian or a Caucasian or a Chinese, you will all look at her face and say, "Nahi, she is beautiful." So what is this which gives her that? It's basically the golden proportions of the face. We have got to have a certain set features on the face in certain measurements. If they are more or less fitting the face, that face is considered as having the good looks. Okay, so we will see in brief what are these features. So we know that aging is mandatory. We are all going to age, but getting old is a decision. So mentally you can still remain young, you can still think young, you can behave young, and therefore you will be young. Okay, so just going by a few wrinkles or gray hairs is not the way to go nowadays. Now let's see what are these. I won't tell you about all the golden proportions, but a brief list of how we look at her face. For example, this girl, she is having a beautiful face. She is young. Why do we feel she is young? Because she is having an unlined skin, smooth skin, very nice features. And the reason why the features are looking nice is because we have what is called as an inverted triangle created on her face. This inverted triangle is created because we should have the widest width of the face at the cheekbone level. Okay, bizygomatic width should be the widest in one of those golden proportion faces. Now, we should have a tapering chin. Not that we should have a pointed chin, but the triangle will taper down towards the chin, which will have a decent prominence. It should not be too retruded forward. That is profile. Profile se dekhne mein we see a different thing. We'll see a straight profile as a better thing rather than a convex or a concave profile. That is understood. But let's look at the frontal view only. Now, second thing that we keep in mind is the bigonial. What are these gonial angles? These are the angles found at the angle of the mandible. So when we look at the patient, we should have a tapering face. We cannot have the angle of the mandible flaring out. In case her angle was somewhere here, then in that case, she would look too manly because she would have got too square angle of the jaw. So what we should have is a 30% taper down. Okay. These are the proportions. So we have a certain bizygomatic width. Then on her face, it is not on everybody. The width can be different for everybody's face. But then it should taper down to 30% at the gonial angle, and then to the chin, the taper will go on and form a point. So we have an inverted triangle, and those who have this kind of features, whether it is Aishwarya or whoever you keep on the grid, you will feel that that person is looking proportionate and good. So these are the main things that you look at: the bizygomatic width, then taper down to the angle of the mandible, and of course the chin will be forming the point. Now, what happens when we become old? This whole thing gets upset because now we don't have those triangles. We tend to have a collapse of the cheekbones. Okay. And so we have a little narrowing at the bizygomatic width very subtly. And we also end up having no point at the chin because we have all sagging skin gathered over here. And you end up having more of a trapezoid. So that is where we have this. In an older person, we start having the lower border becoming little wider than it should be. And therefore, you start having that aging look. Now, what are these signs of aging which cause this change in the triangle to a trapezoid? One is that as we age, our skin and our fat content is going to change. We can't stop it. However good nutrition we follow, whatever, of course, we can delay it quite a bit, but it will eventually. A youthful face has more fat. Aging face will have lesser fat content. It's part of the aging process. Another thing that happens is you have nice prominent zygomatic bones, which is also the main cheekbone in the youthful face. But as we age, there will be thinning of all bone, not only zygomatic bone, the whole, our skeleton across the whole body is going to become thinner. So what happens? The skin doesn't have enough cushioning below it. The fat is gone, the bone is also gone. So the skin sort of folds into itself. It's like the cushion without its stuffing, and you have wrinkles started to form on the skin. And because the support is not there on the cheekbone, the whole skin, because of gravity, is going to sag downwards and fall at the angle of the lower border of the mandible area. And hence we end up with flattening on top and more sagging collection of skin at the bottom of the mandibular area. So what are these soft tissue changes that we see? It's a repeat again. We start getting progressive soft tissue laxity and volume loss. We start getting hyperpigmentation, rhytids, and solar damage because over the years we are going to be exposed to pollution and our own bad habits. If we are into smoking and drinking, and everything is going to take a toll on the skin. We end up having little thinner skin because the hyaluronic acid, which is a natural product, and collagen, which is there in our skin, also starts depleting as we age. Okay, so all these things will cause brotosis because even the eyebrow starts to sag downwards, and which is what gives that old look. Deepening of the nasolabial fold and jowl formation. Jowls are that sagging skin found just lateral to the mental region, okay, at the lower border, which is the one reason for that trapezoidal shape in old age. Then we have, I want you to look at this comparative picture again. I already told you what all happens. Now you can see these changes in her face again. So what do you see? This is young face. Look at the level of her eyebrow, and in an older face, this gets turned downwards. And all this subtly adds to the aging look of the person. Then we have the eyebrow fold, which in a young person is not there, but in an older person, of course, the Chinese, Japanese have a natural fold there, but other races do not have it. So when they have this fold deep, sort of bulging out over the upper eyelid, it adds to the aging look. So in an older person, if you just trim away those excess tissue over the upper eyelid, you have what is called, that procedure is called blepharoplasty. So if you do a surgical procedure also, that gives a youthful look to the eyes. So surgeons do that. We are not going to be doing that in our non-invasive procedure, but I'm just giving you an example how we rectify. If we know what is the aging changes, what will we do to rectify it will be the opposite of that, obviously. And then of course you have wrinkles, the crow's feet wrinkles around the eyes, which again give an aging look because a young person doesn't have those wrinkles. Moving down, the cheekbones have become flattened, the fat content fell down. So therefore, gravity has caused this whole skin to sag downwards and causing this prominent nasolabial fold, turning down of the lips, slight thinning of the fat of the lips also occurs. So the lips also become thinner. So young person's lips are little plump, but an older person's lips are little thin. And then because of that sagging, we have these jowls which will camouflage the jawline of the patient, right? So this is what happens in an aging phase. So it is logical that if I want a person to look young again, I will have to do something to reverse these things. I must eliminate that nasolabial fold. I must eliminate the jowls. I must eliminate the crow's feet, etc. So let us see this video also. From the young to old, I pointed out, look at the eyebrows, look at the eyes, look at the nasolabial fold, and of course, the neck is another issue that will happen. We will not talk about that now. Let's see only the face. Okay, whatever I mentioned to you, in the youth, it is not there. In old age, it starts happening. So you can very nicely observe how the lip is also turned down in old age, and in younger age, we have a straighter line. So in old age, we look sad all the time, and in youthful, we have an upturned lip line. So we look more, or you might say smiley or happier, right? So you can appreciate the same changes happening in the same face as it gets older. The eye becomes tighter, and that is what is giving the younger look to the patient. So if a person in 40s and 50s comes to me, I can help them by changing those factors. Now I know them roughly what is needed, right? Let's move on. Now, so what makes a face beautiful? Obviously clear skin. If you have clear skin, you start looking better anyway. No discoloration, no scars, no wrinkles, no folds. That skin looks nice. Clean and healthy skin will give you that glow. For example, you can see this forehead with wrinkles, and then with less wrinkles, this is looking more youthful. So what are these facial rejuvenation techniques, the non-invasive ones? They are divided into 4 parts. We usually have resurfacing techniques, refilling techniques, relaxing techniques, and re-draping techniques. Okay, so let us go through them one by one. The re-draping techniques are basically, you will surgically lift the loose tissues. Okay, whatever is sagging down will be lifted up. Resurfacing means only the surface of the skin where you're seeing some discoloration, fine lines, or you're seeing some, scars or something which is not giving that smooth look. So you're going to do some ablative or non-ablative techniques for a smoother, even toned skin. For this, you may use physical, chemical, or mechanical means. For refilling, now I told you we get deflated because there's no fat and hyaluronic acid or collagen. You may inject below the skin something like fat grafts or fillers to build up the volume loss. Relaxing techniques are neurotoxins are used to relax hyperactive muscles of facial expression so that you no longer have them forming those wrinkles on your face. So we sort of paralyze them with this toxin, neurotoxin. It's a toxin. It causes paralysis of the motor muscles. Okay. Now let's have a look at the surgical options first, which what the surgeons have been doing all this while. Whenever a person has a face like this or like this, including the neck, which gives away the age, what we do is a surgical incision in the hairline, preauricular, and go behind into the mastoid region. Okay, like this. And then the sparse layer has, that is the skin subcute, and the apneurotic layer is just stripped off till the modulus of the face and pulled back, trimmed. Excessive skin is trimmed because this is quite a loose skin. If you just pull a cheek of a older person, the amount of pulling or laxity you have in the skin is much more than a young person's skin. So you can just pull it back, trim the layer, and suture it, and this gets hidden in the hairline. So now you can see the before after pictures of this lady. And one advantage of a surgical correction is that as old or as lax skin as possible can be trimmed and corrected. And at the same time, the neck also gets pulled. So you start having you can't have just the face looking good and a wrinkled neck because that gives away the age again. So these plastic surgical procedures have been going on for many years. There's not a new thing, but this is not part of our field, but it is requiring a lot of downtime. You need admission in a hospital. You need to wear a face mask for about 10 days tightly around you. You can't go out into the public for a period of time. And then you can only emerge out into the society after, everything is healed. So people do it, and it is meant for people who are having too lax a skin beyond a certain level. Our non-invasive procedures cannot handle every type of lax skin, remember. So there are some people that you will send for this kind of procedures if we are not able to give them the satisfaction with this. And then people are doing other cosmetic procedures like liposuction. We have heard about liposuction for the abdomen, for the thighs, etc. The plastic surgeons are doing it. But remember, even this is not a permanent solution. Even that surgical facelift is not a permanent solution, because over the years, after 5 to 10 years, again the skin will sag. So don't ever think it. So the person who just does it at 60 will have to repeat the procedure if they still want to look good at 70. That same surgery, imagine. The same way liposuction, if you're not going to bother about our diet and exercise, and you think that once the fat is sucked out it will not come back, that is a misconception. It also, these procedures, depending on how much fat is removed from you, is also going to be a little risky procedure. But still, it's one of the most performed cosmetic procedures in USA. And when I talk about fat removal, that is for the abdomen leg. But for us in oral surgery, we also do liposuction for the cheek fat, because we may have too plump cheeks and we want to give a little contouring, because we want only high cheekbones and little less fat on the cheeks. In that case, the buccal pad of fat intraorally is very easily accessible. All we have to do is just take it out, a part of it, and you get that depression in the cheek area, so that the person looks a little bit more contoured. So those who have little plump rounded cheeks can go for this kind of this thing. And another reason on the point on the face that can be addressed in terms of fat is your the submental fat. Some people have double chin, so therefore we can go and do lipolytic injections there. That is a non-invasive part. Another part is that you just take a nick and small incision you make, and you suck out the submental fat. So and then of course bandage it up and wait for 10 days and you're fine. Otherwise, we have non-invasively, we have something called as lipolytic injections available, which is simply chairside procedure, inject, and maybe you will have to repeat it every month for a couple of months, and then slowly the fat gets dissolved. So we talk about cheek and submental lipo compared to the abdominal lipo. Now, I don't know why I feel Karina has done something to her buccal pad of fat, because when she was young, she used to look like this, and now I get more contouring on her face. So I assume she has undergone this procedure. See, nobody's going to tell us, so it's just a guesswork by looking at their faces. Then we also do something called as dimple creation surgery. A lot of people like to create a dimple. This is a surgical procedure. Yes, it adds to the beauty. Then the other non-surgical procedures that we don't do, but makeup is a great way of hiding a lot of our facial features and their flaws. For example, look at this girl. She had a very ordinary round face, but after her makeup, she's managed to look so much more leaner and more contoured, right? So yes, makeup experts also do a wonderful job. So don't forget that. But of course, these are not permanent things. It's only till the makeup lasts, you're going to be having the effect. So that one, those are the side or what to say, the disadvantages of these things, right? So yes, hairstyles have been our ancient times ways of camouflaging our broad foreheads, creating a fringe. If you have a very wide jawline, then you can hide it with that, like she has done. You can keep your haircut in such a way. This girl has made a bangs to cover her wide forehead. So hairstyles, yes, you need to have a very you need to have good skill in the hair cutting department to do these things for yourself. But none of these things are going to change the nature of your skin. So therefore, we are the ones going to give them procedures which target specific depths of facial structures and treat localized facial concerns. Like we will try to eliminate wrinkles, skin laxity, hyperpigmentation, scars. We'll try to handle that with our procedures. Now, what are the list of no knife techniques? We have lasers which can help us, and even things like radio frequency technology. We have microdermabrasion, chemical peels, injectable fillers, botulinum toxin, thread lifts, microneedling or collagen induction therapy, mesotherapy, platelet-rich plasma. These all are our non-invasive techniques. So let us start with the first one. When I told you there are 4 basic techniques, I've classified them like that. We have resurfacing techniques, for example. in which we are going to change the texture of the skin, okay, using lasers, chemicals, or mechanical means. So what are these? For example, lasers for skin rejuvenation are used for skin resurfacing by removing the superficial cell layers, removing the superficial pigments, and even softening the scars. The non-ablative fractional erbium laser is safe for Asian skin. Now we will find that the whites are better benefited by certain type of lasers. Now here we are in a field where one laser will not do everything. Let me tell you this also. No shortcuts. If erbium is better for skin resurfacing, you will find that something else is better for tattoo removal. The same laser will not work for tattoo removal. Okay, so this is something you have to be clear. That's why I mentioned the type of laser which will be useful for this. And we need to buy that many types of lasers if we want to do facial aesthetic work. And yes, none of this is going to happen overnight or with one session. You need multiple sessions of laser therapy for that skin wrinkle to go or that pigment to go. And we have changes which are quite good. You can see the tightening of the skin and the lessening of the wrinkles like this after multiple sessions, of course. Then we have lasers for skin pigment removal. And nowadays, a lot of people come for tattoo removal. And these are again, like you see in this picture, after 9 sessions, we have managed to get the tattoo to fade. Now, the laser which is useful for this kind of pigment removal is a ND-YAG laser. Okay, so we have a Q-switched ND-YAG laser which does more efficient work for this type of tattoo removal or pigment removal from the skin. Then we have lasers for hair removal. Now we have another type of laser which works better on removing the hair, because basically hair is reduced by targeting the dark pigment of the hair at the root and destroying it on contact. Diode lasers and alexandrite lasers give a better result as they target pigment better. And amongst this, the alexandrite ones are better for the white skin, but diode ones are great for the Indian skin hair. And therefore, why we should know this base thing is when we buy the machine, we'll have to make sure that they are of this particular type. And yes, it works. After a lot of sessions, the hair of any part of the body, arms, legs, back, front, face, anything can be removed almost permanently. Because I say almost permanently because some of it might grow back after a few years. Then you just do another dose of the laser and get it back into control. And yes, men also need it. Nobody wants so hairy backs or chests nowadays. I think men are also shaving their chests. So we need it quite a bit in both the sexes. Microdermabrasion is another skin resurfacing procedure. So what do we do in that? We have diamond tips with the suction that is used to exfoliate and suck out and resurface the skin, making it smoother and more toned. It will improve the pores. It will unclog the pores. So all those whiteheads, blackheads, whatever you have, it will remove the fine lines. It will take care of the mild acne scars. It will make the oily, dull skin become less oily, and it will improve the texture overall. So there's a handpiece with a diamond disc attached to it with the suction going on at the same time, so that whatever debris is loosened out by the diamond disc is sucked away immediately from the site. And even in a single sitting, we see a lot of difference. But multiple sittings are going to help with a little, if you have skin with a little deeper problems like this. Okay, it works. These are all old acne scars which have been smoothened out over multiple sessions of dermabrasion. Another resurfacing method is using of chemical peels. It's also called chemofoliation or derma peeling. The use of a chemical on the face makes the skin peel off, allowing new skin to replace it. The new skin is smoother, less wrinkled than the old one, and also useful to control acne and remove pigmented spots and scars. So peels also are a multiple session. Yes, the skin may peel off like this, and then you can see so there is a little bit of downtime. You will have little redness, but then what comes out afterwards is wonderful new skin. Acne is very beautifully handled by peels because we have a nice salicylic peel which is devoted only for acne patients, which is eventually will dry up the acne, and the patient will stop having less and less acne as they work with this. A lot of people have been using peels as a regular basis. In fact, it's better than going to a parlor and getting a facial, because you just do a peel and 7 days later you can attend a function with a real glowing skin. Even if you don't have defects on your skin, if you just want your skin to glow, this is the way to go for it rather than your massages in the parlor, because massages in parlors are literally not able to get their products deep inside the skin. They can only massage the the top portion of the skin, right? And you feel good for that moment, but it doesn't last. But when we do these lasers or we do dermabrasion or we do peels, we are definitely we are literally stripping off the top 25 layers of the skin, which is then going to help your active ingredients to penetrate deeper where they can work better. Now we come to the other type of this thing. We do refilling techniques, the use of permanent, semi-permanent or temporary fillers. Like I told you, our skin gets deflated because of loss of bone or loss of whatever, fat. So we can sort of refill it. So if my cheekbones have fallen down, I'm not going to build up the bone, but at least I will try to lift the skin over there, and I'll tend to have a little, when I put a filler on the cheek area, automatically it will blow up, and therefore it'll pull my jowls also a little bit up. So to some extent. So all that folds which are caused at the lower half of the face will get lifted up, and I will have a face lift by using just skin fillers. So these injectable fillers are soft tissue fillers injected into the skin to help to fill in the facial wrinkles, restoring smoother appearance. But they are temporary because they are gradually absorbed by the body. And the content is basically hyaluronic acid, which is already found in the skin. So it's not a foreign body that we are putting in. And I'm not talking about, these are the temporary fillers I'm not talking about the permanent fillers like silicone and all. Now they are using permanent fillers in other parts. The plastic surgeons are using it for breast augmentation or for butt augmentation and other things. But we are not going to use it on the face because we don't want, those things are usually contained in a pouch. If you have migration of those things here and there, then your whole face will get disfigured. So actually permanent fillers are a little tricky to use and in fact not preferred at all. So it is better to have, even though you may have to top up every year if you want to keep up the look, but it's still safer to have these absorbable fillers. So there are examples, the brand names are usually called Restylane or Juvéderm. And here is you can see a patient who may have a little thin lips. This is a young patient, not an old patient. So she may want to improve her looks and may go in for a little thicker lips because they look better. And of course, the lipstick always sits better on thicker lips than on thin lips. So everybody should have a good pout. Here in this girl, you can see the cheekbone has been lifted. She's also young. She's not old, but she felt her cheekbone was a little flat. And if she has given it a little contour by just filling the skin on this area, she's subtly looking better. People may not even realize what has changed on her face, but she will look good. So we can give these kind of chair side things to the patient. Within 5 minutes, they walk out of your clinic and they look great after that. These are just 10-minute procedures on the chair. Okay. So you can do multiple filling areas. Somebody has very thin temples or cheeks or lips, whatever. You can just fill any area of the skin or chin or nose and get your enhancement of those areas. Now, we know that the film stars have been doing it always. I mean, if you look at your old pictures of Aishwarya, her lips are still as thick now at 40. That is not possible because as we age, our lips do get thinner and thinner. So if she is maintaining her lips at this same thickness or even more maybe, it's because she is definitely getting fillers done there. And so did this lady. Okay. So now another method I told you was relaxing the muscles. So temporary paralysis of key muscles of facial expression will handle the wrinkle forming muscles. So we'll just freeze them. So we will select those muscles. We can't allow the toxin to do everything to the whole face and look frozen face. We don't want to have a facial palsy look. Okay. So neurotoxin produced by Clostridium botulinum, it prevents the release of acetylcholine at the axon endings of the neuromuscular junction, causing flaccid paralysis. Luckily for us, it is reversible and we can get back our function within 6 to 8 months. So therefore, a person wants to continue having the effects of it. They'll have to repeat their injections every 8 months to continue having the non-wrinkle look. Okay. And yes, it's a very lethal toxin. A very few nanograms is required. If you give it per kg to even intramuscular or IV, you could end up with death. But we are never ever going to use that much for our facial aesthetic work. We are well away from the danger or the lethal dose of that particular drug. So yes, toxin, you can see what it does. This lady's wrinkled forehead and frown lines have been just simply handled by a few chair-side injections of the toxin, and the person is looking, just clearing up only the forehead itself is giving her such a good look. Men also, you can see this, frontal lines are gone, the person is looking younger. Same thing here, frown lines, frontal lines, everything is looking great. Crow's feet also can be handled by giving injections here. Gummy Smiles, very easy procedure. One was that you do a surgery on the lip and tether it down and so that it doesn't climb up during smiling. That is a surgical procedure. Now half the patients will say, I don't want to do any surgery. For them, you have an option. Of course, they'll have to repeat the injection every 6-8 months, but you just give a mild injection here, one in here and one here, targeting the levator labii oris muscle, and you have the lip. She'll be smiling naturally, but it is not going to climb up beyond to show her gums. Jawline slimming is another use of this neurotoxin. I told you about the proportions. If you have two prominent masseter muscles in the side or here in the gonial angle over the angle of the mandible, we are not getting that 30% taper from the cheekbones. So in that, this 30% taper. So if you want this, you simply inject the masseter muscle, cause a disuse atrophy because you have paralyzed it. Therefore, the muscle is not moving for 6-8 months. And what happens to our muscles when they don't move? They go into disuse atrophy. So therefore, you have a slimmer masseter muscle over there. Now, these are the cosmetic uses, but let me tell you, once you start learning about neurotoxin, in all fields, including prosthetics, we can use these muscles of mastication. We can control them. We can reduce their load of chewing, because in our full mouth rehabilitation, we don't want their muscles to be so powerful, especially in a younger patient who has lost all his teeth and goes for complete dentures, or goes for full mouth rehabilitation with implants. Then you don't want the chewing force to be so high. So first we learn these things for aesthetics, and then I realized while working in my field that I can help a lot of other dentists, the prosthodontists or the orthodontists also, by giving selective paralysis of some muscles which are interfering with their appliances, you might say, and therefore help them with that also. Now the next part of this thing was in lifting the sagging skin. Okay, so in this, how do we lift the sagging skin? We will insert a resorbable thread below the skin surface in different tangents. These are called thread lifts. It's a very safe, convenient, and it's a little bit more invasive than normal. But yes, because you are inserting a lot of threads below the skin, you can just simply pull these sutures and they are going to achieve tightness and lifting. And these threads are then lasting inside below the skin. Even though they get resorbed, they get replaced by collagen, and therefore the lift stays for almost 2 years. There's a little bit more longer lasting lift with a little bit more invasive procedures. So thread lifts are those methods. And yes, you can see this jowl disappears when the threads have been inserted and lifted, and the person starts looking really good. The jawline starts becoming visible when you have lifted the skin up. So we have these threads put in different angles, and we may have to put 8 to 10 to 15 threads to do that. But yes, this is one of the methods of doing it. There are some more pictures before after of thread lifts, and thread lifts are great for the lower half of the face. For the upper half, we have the use of toxins which help us to keep the wrinkles away. Then there is something called as microneedling and collagen induction therapy and mesotherapy. What is mesotherapy? It's basically a technique which uses injections of vitamins, enzymes, hormones, and plant extracts to rejuvenate and tighten the skin, as well as to remove excessive fat. So basically, you will try to embed these things below the skin. So how will we do it? Now, this is how you can improve even the skin texture by mesotherapy and microneedling. Okay, you can see how discoloration is reduced over multiple sessions. These are 3 microneedling sessions, and she is looking so much tighter and better, and even her melasma is faded. This guy has a lot of scars that has gone. Then you can see again the skin improving. Even the nasolabial fold and these marionette lines over here have become little fainter with multiple sessions of microneedling. Okay. Platelet-rich plasma, everybody is using, maybe not injection therapy, but we are using fibrin. Platelet-rich fibrin is very popular in implant therapy. They are having growth factors inside these platelets, which we can use even for our skin and hair rejuvenation. We'll simply inject this PRP into the skin and hair and cause better skin cells to form, better hair follicles to form, and therefore person who's losing hair like this, if he starts on PRP therapy, you can see the word here, 8 months. Don't expect this hair to come in just one session of PRP. We will get back hair, because what we are basically doing, in other words, is something like we are putting a fertilizer to the hair roots, and the hair will then come out with a much better quality hair. And somebody who has hair loss because they are having genetically predisposition for it, don't expect that you will control it. I told you Salman has gone for 3 sessions of hair transplant itself. We are talking about hair regeneration, where we will try to delay the loss of hair. At least even that is better than losing it at a younger age group. So we can try for a PRP therapy where at the earlier age you do it, so that you wall off that time at which you're going to lose it completely. We can also use PRP on the face because it is a type of mesotherapy. So I'll take out blood from the vein, I'll centrifuge it, I'll make my PRP, and I will maybe directly inject into multiple spots of the skin on the face also. Or else I will use a derma pen, which is having micro needles on it. I will put the PRP on the skin, and then I will just move the derma pen with its needles across the skin so that I have minute pricks created. And that has been nicknamed vampire facial. Just using PRP on the skin is called vampire facial actually. So it's supposed to overall deliver this PRP below the skin because I'm making punctured wounds on the skin. Of course, pain control, all that is managed. We don't give pain. Nobody will enjoy your facial aesthetics if we are going to be, creating painful procedures. There are all ways of handling the pain part also. And then you are going to have wonderful skin, tighter skin, because collagen will form better. Whatever was depleting in an older age group, now you're sort of stimulating it to come back again. So you're basically stimulating the body to work again. And you remember one thing, even though we have seen so many types of methods of using these, facial aesthetic procedures, never one is useful for everybody. You may have to mix and match to build up that face. You'll have to really analyze the face and see where you need to put what. Like for this lady, for example, is a combination. Her lips were a little thinner, so little bit they've been filled up, not enough to create a artificial pout. She had little wrinkles. We'll give some little Botox. But if her cheekbones are flattened out like here, let's just a little bit of filler on the cheekbones. So we have a combinations going on the patient's face. We have to learn to analyze and use all these to make a better looking face. You can't say only fillers will work or only toxin will work or only thread lips will work. Not like that. You will have to analyze and decide where what is. So you have to master everything so that you can give a complete treatment to the patient. Then again another face which is looking fresher just because all 3 things have been used here also. A little tightening of the jawline with thread lifts. All her these nasolabial folds have been eliminated. Cheeks have been a little bit lifted because when we become old, that is what falls flat. So as soon as you do that, she looks younger. We don't want her to look 20. Nobody is aiming for that age group. It's just that even at 40, if you look 30, it's great. Something like that. And mesotherapy for the hair is well known. Whoever is losing hair will need to just take care by doing PRP therapy. We also have ready-made, these companies, the skincare companies have products with vitamin E, biotin, etc. Whatever is good for the hair or skin, marketed in vials. So if you don't want to use PRP, we can always buy those vials and inject them below the skin. Mesotherapy just means delivering of these products below the skin, whether it is with injection form or whether it is by punching holes in it with micro needles and then rubbing that material inside. Okay. So mesotherapy just means that make sure and what are parlors doing when they do moisturizing or whatever? They may use vitamin E creams and whatever, but they are only trying to push in the material to our regular skin pores, which are not large enough for the material to go in sufficient quantity to really cause the skin to react by producing more of collagen. That is not going to happen. But with our mesotherapy, because it directly traumatizing the skin surface by punching it with needles, or we are punching micro needles there, or directly injecting below the skin. So our skin itself is stimulated to produce. So we get a more natural type of, healthy looking skin after a few months. So hair, of course, you can see these pictures of before, after. Of course, these are after 6 to 8 sessions. A person this old can also be made to look great with all the help of all those things. Now, also you must know about another cosmetic procedure called microblading and pigmentation. This is simply doing tattooing actually. Tattoo parlors are not run by doctors, yeah, but people are still going to them. They also have a ink. They have a pen with a microblade which inserts that ink into that and makes the design, right? But in our case, when we don't want to call it tattoo, so we call it microbleeding. So ours has to be a little bit, a medical term. So we are saying microbleeding and pigmentation. But yes, ours is a little different type. There might be people who may want a permanent lip color. So you can embed certain shades of pinks and oranges and whatever. Then you can make a permanent eye shadow look or an eye liner look. You can embed that black line around permanently. So you don't have to keep applying the makeup also. Then we have something called as making eyebrows. There are people who have a little thin hair or scanty hair or no hair. Okay, you had an accident, you got a scar on the eyebrow itself and the hair doesn't grow back there. You have, cancer surgery patients who are recovering and may have lost hair. You have vitiligo patients. These are the real proper cases for which you can use pigmentation other than just cosmetic. But for them also it's cosmetic only. You're giving them back their life. They become so conscious of their disfigurements that if you could give them back. So vitiligo, what happens? The skin color goes away. The pigment is gone. So if you can put that light brown shade of their own skin match to that area, the person's defects are camouflaged. Then there is I can just tell you about nipple forming. We have breastectomy, mastectomies done, right? The breast is removed in cancer patients. They do not have the nipple over there, so they can be tattooed over there. So they have a little natural feeling about it. Eyebrows can be made again. These are the ways it works, and I'll show you another way you can camouflage things. The hairline. Now this lady, suppose she doesn't want to undergo a hair transplant, so you can simply draw black lines onto her hair and it looks as though she has hair over there. In this case, he is balding here, but he doesn't want to undergo a transplant, so you just put dots of black. He might agree for tattooing, and therefore it looks he's a young man who's just shaved his head. So the look has changed. You can see in this two pictures. This lady is losing her hair here, but when you're drawn these lines like this is called microblading. You immediately feel her hairline is okay. So these are the various ways these pigmentation techniques can also be used to help your patients to look better when you learn these techniques, right? And yes, public awareness is spreading because I found this article in Times of India in which when Deepika and all were getting married, I think they started using the word vampire facial in these particular texts over here. So yes, people are now reading about it. They are watching Google and YouTube and they're learning about it. So when you tell them about it, they will be convinced to do it because they didn't know it was accessible. They think it's all done in very fancy clinics and it won't be done in your neighborhood dental clinic. So therefore, many of the people were going to Bombay or Delhi, especially Bombay, and those who were in Bombay were flying out to USA for doing it. So it depends on your affordability, right? So if every second person starts doing it, it'll become our treatment to do in our dental chairs. So yes, I also do training for these courses. If anybody is interested, you may please call me, or even if you have any other questions, you can mail me or WhatsApp me at this number and ask any further questions that you have. So thank you. And I'm very honored to have been able to sort of, I hope I could get something across. There are a lot of misconceptions about facial aesthetics and everything was just Botox. The word Botox I never used in the whole lecture. Please note, I said neurotoxin. Botox is basically a brand of neurotoxin which is sold by an American company. There are many other neurotoxins. It's like Brufen, and you can have ibuprofen under different brand names. Like that, Botox is a brand name for a botulinum toxin, actually. So we should not say he got a Botox done. Not necessarily I'll use a Botox in my clinic. I may use some other brand also, right? So this is what I hope people got something out of this lecture. So thank you.
Hello, am I audible, Anmol?
No.
Yes, you're audible.
Yes, yes. Thank you so much, ma'am, for putting up your knowledge, your experience, and everything that we had misconceptions regarding. And thank you for showing the pre-op and the post-op pictures of everything from very basic things to all the advancements that you have shown. I have personally enjoyed this lecture very much. So thank you and I congratulate you for this lecture. Ma'am, we have a few questions regarding your session.
Sure, please.
Ma'am, Dr. Apeksha wants to know what are the maximum side effects of the botulinum toxin? if you're
Oh, there are a
using.
lot
So
of side
what?
effects if we are careless. Yes. Like, see, whenever we are doing
Absolutely.
anything, don't ever think that these procedures are not going to have side effects. Even dentistry, whatever you do, you give local anesthetic, you know the list of side effects we learned from
Side
Malamint,
effects.
right? That still holds true.
Yes, ma'am.
But how often do we get those side effects? If we are careful, we have mastered our techniques, we rarely ever have complications of our local anesthetics. The same way, when we learn botulinum toxin injection techniques and the whole theory behind it properly, you will never make a mistake. What can possibly happen in case you're careless is that you are not injecting into the site that you should. Okay. If you are injecting into a site away from what is causing, in fact, you're targeting a muscle which is, not to be targeted, you could end up with any facial palsy. Mein kaisa, you will have crooked smiles, you'll have one brow ptosis, one eyelid is closing and the other one is not. And then there is no antidote for it, let me tell you. You will have to tell the patient, please wait 6 months, it will go away slowly. So that kind of tragedy in facial aesthetics, which is a not an emergency procedure that you're doing, it's an elective procedure, is cosmetic procedures. We can't afford to let that ptosis happen just because we, injected a little bit extra amount than was required, or we injected it in the wrong direction. Or, there is a small tip when we do toxin injections, we never do massaging. Like if you have injected the toxin, at the most, if a small bleeder has come, you will keep a pressure over that injection site, wherever, for example, frown line. You can keep a pressure with a gauze over there, but you don't do like this. Okay, if you rub it like this, like we tend to do with local anesthesia, we'll do like this, and we'll try to diffuse it into the tissues. Here, we don't want to diffuse it into the tissues. We want it to stay where it is. Because if it diffuses, it will start going towards the muscles, which we don't want to be paralyzed. So mainly the problems with this is not very permanent, but what will happen is, but it will last 6 to 8 months, is that you will get wrong muscles paralyzed. So you could have eyelid falling, you could have droopy eyes, you could have corners of the mouth falling, those kind of things. So these are the only, otherwise there's no allergy to this, no known allergy to Botox or toxin rather. And there is no side effects other than having excessive doses and paralysis of wrong muscles, mainly. That is the only issue.
Thank you so much, ma'am. Ma'am, next question is from Dr. Isha. What types of peels are to be used for normal skins? People who just want to look more better than in a normal skin. So what
You
types
can
of
use
peels can be
any
used?
of the peels. Any of the peels. It depends on, um, uh, like if it's normal skin, you can use. See, these peels all come with a set of instructions in their. There's a booklet of instructions with every peel. So in case it's a normal
Yes,
skin,
ma'am.
glycolic, salicylic, these are all good enough. Then there is something called as yellow peel. These are all good even for normal skin also, because what they are also nicknamed party peels. You want you to look that extraordinary glowing look on that D-day of somebody's engagement or your own engagement or marriage or whatever. Then you can go for these peels because they are not meant for specifically for scars or pigments or anything. This is all for normal skin. Everything can be
Yes,
used for
ma'am.
normal skin because it is going to give your skin to improve. Because what is it doing? These acids are going to uh, literally eat away the top layers of your skin and cause
Skin.
a new skin cells to come up, and you're going to help those skin cells to come up with a better healthy skin by drinking lots of water. We give some home care instructions. We What is a cell after all? It is almost 99% water.
100%
So
water.
person who
Yes,
doesn't drink water is going to have dehydrated skin only, always. So if you say मैं ऊपर से वो paint करूंगी and you look pretty, no, the person will have to start changing their lifestyle. They'll have to start drinking 2 liters of water daily also, and they will also have to take what is going to form again. Collagen is going to form below the skin. So I need what helps collagen formation? Vitamin C. We know this from the
vitamin
beginning.
C.
So
Beginning.
now,
Yes, ma'am.
luckily, COVID era, mein, again they're saying please boost up your immunity
Please.
with vitamin C. So it's a double boost for them. Have lots of every day one vitamin C or have a citrus fruit. Do your peel, look great on the day that you want. Give a margin of 7 to 10 days, but after a peel is not that you want the skin shedding on the day of your function and all. So just some care like this if you take. We can use any peel for the skin. It works out fine. Just follow the instructions because with peels you
Instructions.
can get burns basically. Okay, you can get tanning because the patient was careless while going home and not doing home care properly. So you did something nicely in the clinic, but when the patient is not following instruction, there could be side effects of increased darkening of the skin, in fact. So then she or he will come back and start cursing you as if it is your fault that the skin got darkened. So we have to take care. We have to tell them some things post op. So we
Yes,
can
ma'am.
use any peel for a normal skin.
Yes, ma'am. Thank you, ma'am. Ma'am, next question is from Dr. Rashi Verma. She wants to know what are the best courses for learning facial aesthetics in India specifically.
Oh, there are many courses being done. I mean, all across, like even I am doing a course here in Bhopal. So if somebody wants to come down, they are welcome to. But otherwise, there are many courses in Bombay also. They come up in Facebook. If you're into Facebook, you will find a lot of advertisements. जैसे इम्प्लांट
Plenty.
कोर्सेज
Yes,
अक्रॉस
ma'am.
इंडिया हो रहे हैं वैसे ही फेशियल एस्थेटिक्स के भी हो रहे हैं दिल्ली में भी कोई करता है hair transplant is not usually should not be clubbed with facial aesthetic because facial aesthetic समझने को और उसकी assessment करने को we will take time, right? So if you want to do hair transplant clubbed with it, then hair transplant should be strictly done separately. Don't go for courses which will
Separately.
mix
Yes, ma'am.
both. One day will be devoted to hair transplant and 1 or 2 days for this. You will not learn anything. I'm telling you. You will end up with too much of knowledge, which will in the end make you
Confusion.
paralyzed. It doesn't work out like this. And regarding hair transplant, I would suggest medico-legally, thoda sa, other than oral surgeons, better be careful when you're
Yes, ma'am.
practicing
Next was the
because,
same question.
yeah, the medicos are not liking our ingress into this field now because dermatologists feel it is their field or whatever, but they are, we can fight it out. That is not a problem because face is us. They
Yes,
are
obviously,
also
ma'am.
entering into it now. Let me tell you, dermatologists also
Now,
never were there into it.
just
They also realizing that it's a cash cow. You can, make money out of this because otherwise skin diseases akele manage karke they were not making so much. People don't go also. India में तो people are so typical.
yes, ma'am.
जब तक वो पूरा डिसफिगर नहीं कर देता है उनको
पूरा
eczema, psoriasis तब तक they must be not reaching the
No.
dermatologist also.
Yes.
Now even the dermats have discovered this facial aesthetic part, so they are feeling it is ours. Why are the dentists coming into it? So if you don't want to
Coming
create too much halchal and have people sue you and try to win over court cases and then make defined rules. अभी rules हैं नहीं. Now there are no rules
yes,
in
ma'am.
India saying that you can do or you cannot do. But a hair
But still,
transplant
there
is
are
a little invasive. I would suggest those procedures a
just
non-surgical person
surgeons
should not do.
should not
This
do.
is I feel. I know a lot of
Yes.
BDS guys
A lot
are
of people
doing
are
very
doing
good work.
good.
Yeah, they
Yes,
are
ma'am.
doing definitely. But जिस दिन complication हो जाता है ना, उस दिन फिर वो publicity negative मिलती है, and it has happened with a lot of
Absolutely, ma'am.
people. Yeah.
Yes, ma'am. Yes, ma'am.
So it's at your own risk. I myself don't do hair transplants. I'm not interested in it as of now. So I don't club hair transplant, and I would not suggest anybody go for a course which says दोनों काम कर रहे हैं वो उसमें. That वो एक दिन देखने में आपको
एक दिन देख
नहीं समझ में आने वाला
नहीं.
ज़्यादा.
You have
So
to
go
undergo
for
a proper training,
yeah,
ma'am.
go for simple things first, then build up your practice, then go for the pigmentation part. You can go for it as a separate. So pigmentation is also
So,
not taught in clubbed with this, but I've showed you
yes,
all
ma'am.
the range so that you know
Yes,
what
ma'am.
you can aim for.
That is what you have widened our horizon of thinking ki from this particular small thing to be done into clinic to all these procedures that can be carried out
Yeah.
within your hands.
Hmm.
Ma'am, next question is how long does these peels and all these treatments last? And if they are to be repeated, what are the success rates for the same?
So they are very safe to repeat. In fact, you will have to repeat. And in fact, you will have none of these procedures, even if you do skin resurfacing laser or you want to remove some pigment from the face, some melasma from the face or whatever, or even those pimple scars which people have got in teenage years and now they are like 25, 30 years old and they come to you with, the अब scars nikalo and give me smooth skin. All that is going to take them multiple sessions to do it. And if you're not able to, during consultation only tell them this, they will build up too much hopes. So do not be very practical in telling them that you need to come every month. Every month, this procedure, these resurfacing procedure, lasers, whatever, never done less than in 30 days period. Okay, you need to
Yes, ma'am.
work
Yes,
in
ma'am.
30 days gaps only. Don't think that if I do every day one session, the person will be fine in 7 days. No,
We'll find.
you'll only cause
Yes,
burns,
ma'am.
right? So you don't damage the skin so much that you start having burns and other things or scars created because of your activity. So we wait for the
Yes, ma'am.
skin to be hit by these things and then we wait for it to recover, then we hit it again, so we have a monthly interval in which we do all the sessions, including hair removal. It should be a monthly session.
Yes, ma'am.
And I told you minimum 6 to 7 sessions. If you're doing neurotoxin, it works for 6 to 8 months. So every patient, एक का 6 months में हो जाएगा, एक का 8 months में होगा. You can't say. Everybody's facial animation, it depends on how much muscles they use for expression. Like those who have a very animated face will wear out the toxin faster. It's understood because muscle activity will try to eliminate that toxin from there. But if a person is a sort of straight face person all the while, and also he might last even for 1 year without having to need a second injection. So it's customized. Every patient will be coming to you at a different stage of their this thing. Yeah. And you can tell the patient, in fact, you can tip the patient ki, I put a toxin for you now. Don't try to keep frowning. Try to keep a straight face all the while. If they can do that all their life, because those who are frowners will always be frowning. It's natural for them, right? Those two lines will form. They say, I'm a frowner because I have two lines already on my face. So if you tell me, you keep smiling only. So it might be little, my frown may be not angry frown, but my expression, concentration also I will look with frown, na? So it depends on. I've seen a lot of youngsters who never do this also. If I tell them to do like this, they're not able to get their frown also together. So those guys will never have a problem. So everybody's muscles expression is different. So don't have a set rule, but roughly toxin also needs to be repeated every 6-8 months. Fillers are resorbable. They last you 6-8 months. So when you have topped up the cheeks or wherever, they will last for 6 to 8 months. And then gradually fall down again with the help of gravity and everything. Then you need to fill up again and let me tell you, once these patients who are interested in these things, they will come back to you because they get hooked to this. Yeah, they get hooked to this and they want to see themselves like that again. So it automatically happens that they will come back for those top-ups. And we don't want it to be permanent also. Please think of it like that. The negativity in the permanency is that what if they didn't like their look and they say, "Ab change kar do usko wapas." How are you going to change it? Then it's difficult.
Change it,
right?
Absolutely, ma'am. Ma'am, if any surgery or any particular treatment has been carried out on a patient, and if suppose after 6 to 8 months it is regressive, all the changes have been gone back to normal. So are there any withdrawal symptoms or anything like that if patient does not come up again for the same treatment or changing the
side effects? No side effects, no problem. It's up to them. Unko kharcha nahi karna hai, so they don't come back also. They have to have the money for these procedures to continue. So
all we have to do is promise less and do more.
Yeah. Yes.
So we are ending up with a session, ma'am. Thank you so much for sharing your knowledge and answering all our doubts and questions and queries. I thank and congratulate you for doing this session.
Thank you so much for having me.
Yes, ma'am. I call Dr. Anmol Bagadia for concluding this session, ma'am. Dr. Anmol.
Good morning, everyone who are present here from India and all parts of the globe. Thank you for being with us. I'd like to thank ma'am for giving such a wonderfully informative lecture. Ma'am, the lecture was very interesting and it was enlightening too. It highlighted the points which would help all the practitioners to step into this, and the oral surgeons who had some misconceptions also must be cleared via this session. Ma'am, it was a really amazing lecture. I thank you for giving us your valuable time. Also, I thank Dr. Prateek for hosting the session, and I thank each and every member of my Cynodent team for being a supportive role in every session. Thank you, ma'am, again.
Thank you.
Thank you so much, ma'am.
Thank you. Goodbye.
Bye, ma'am.